Hey everybody, this is Professor Beth RN from nursing.com, and today I'm here to help you break down, understand, and strategize answering next-gen questions. While nursing school gives you a solid knowledge base, clinical judgment makes you the safe new RN when you're caring for patients. I'm here to help put your mind at ease with these unfamiliar question types so you can pass that NCLEX and ultimately start your dream career. Let's get started. Okay, guys, so how do you know this is a highlight type question? These could be easy to spot. So when you're looking at this, it's going to be presented in two different ways. You can see a text format, so you're thinking something like nurse's notes or a whole case scenario, or possibly a table or bulleted list like lab results. You're going to be instructed to click and highlight the relevant answers to a specific question. So don't get caught up in distractors. We're looking for what is relevant. You can have a max up to 10 options to select on this type of question. So anywhere from 4 to 10 of these areas can be highlighted. Again, it could be attached to an electronic health record, EHR, or just nursing notes. You're going to be asked to analyze cues or prioritize a hypothesis. So for these, you're thinking of something like click to indicate the client may be experiencing a complication, right? So you're looking for some kind of symptom. And if you're asked to take action, then you're going to be reviewing client information that requires immediate what? Intervention. So make sure that you can get comfortable with that clinical judgment model and that verbiage. Okay, it's going to help you understand what they're looking for. So let's go ahead and let's do a question together. Okay, so I have nursing.com up and we have what? This looks like a highlight table to me. So here is my table and here is my little scenario. And so before I start looking at answers, that's what we tend to do as students. Let's look at what the question is telling us. So I'm a nurse in the ICU. I have a 78-year-old male. He's had weight loss, decreased mobility. He's had a loss of appetite. We did a skin assessment. He has a stage 1 pressure area. So they started TPN. We've placed him on a pressure reduction mattress. We've put some barrier cream to that stage 1. We're repositioning this guy hourly. He's being mobilized. PT is on his case, moving him around for strength and mobility. And he's alert and oriented to person, place, time, and situations, so times 4. His muscle strength is normal right now. And we're going to click to highlight findings in the table below that demonstrate that interventions have been effective. So our interventions have been effective means what? Positive outcomes. So let's look. I'm going to click to show possible answers. So all of your highlighted options are pre-selected for you here and on the NCLEX. So neurologically, he's alert and oriented times 4. He already was when he came in. So I don't think that means my intervention has been effective. We're not fixing that. He does have muscle strength normal in the upper and lower extremities. This guy came in with decreased mobility and has been working with PT. I think that is an effective outcome from an intervention. His skin has no evidence of deterioration or additional injuries. So we are doing the right thing. We are keeping that stage 1 from moving into a stage 2. I like it. Effective intervention. 1+ non-pitting edema found in the lower extremities. So to me, along with this S3, that sounds like fluid overload to me. So I don't think that is good. I'm going to skip that. Gastrointestinal, flat stomach, non-distended. He has bowel sounds. He has no pain. This is a little tricky, but I don't think this man came in with pain. I think he came in with weight loss and a loss of appetite. And we started him on TPN. So I would feel like weight gain would be more a sign of an effective intervention here. Or outcome from an intervention. I'm going to skip that one, but it's tricky. We'll find out. And then increase in muscle strength and balance. Again, low mobility, stage 1, working with PT. I like that. So these are the 3 that I was able to choose to correlate with an effective intervention. So an effective outcome. Submit. Boom. We got it. We got it, guys. So I had 3 out of 3 right. So again, There could be up to 10. And just so you know, nursing.com always gives you your rationales, because when you miss a question, you really need to make yourself notes. Why is the right question correct? And why are the wrong answer choices wrong? Because it's probably going to help you on a future NCLEX question. Always remediate what you miss, even if it's just bullet points. Okay, our scoring rule. So how are these scored? This is scored using the plus minus scoring rule. And all that means is you gain a point for every correct answer, but an incorrect answer will subtract from that total. Now, what do I appreciate about this? The least amount you can get is 0. There's no such thing as negative scores on the NCLEX, which is a positive in my book. Again, just to review, our item type is highlighting. How do we answer? We're going to be looking for relevant information, whether it is in that paragraph, that table, or a bulleted list. What's going to help us is carefully reviewing all that information, whether it's a nursing scenario, a table, whether it's connected to an EHR. So toggle through all those tabs, right? Nursing notes, history, labs, look at everything. And then finally, clinical judgment. We're going to be looking at cues, hypothesis, and action. So get to know that clinical judgment model verbiage right away, because these are going to help you decode these questions. You guys got this. Apply your nursing knowledge to these question item types. Use the tips and tricks we discussed, and I'll help you answer your NCLEX questions accurately. Before you know it, you'll be celebrating passing all your tests, including your NCLEX. I can't wait to celebrate with you guys. If you want to learn more, come see us at nursing.com. We have more questions and practice for you. All right. And as always, happy nursing.